So, one of the parts of becoming trauma informed at the YWCA in Toronto was to do a lot of training um, with staff across all the different program sites. And so we created some PowerPoint presentations to get us started in these trainings, as well as lots of practice scenarios, etc. So, what we're showing you in these little clips on the website of are some abridged versions of those PowerPoint presentations so that you could use them in the course of integrating trauma informed practice in your service, and then add to them at the end with things that are really relevant to your context. But of course, one of the things we started with at the YWCA in Toronto was just even talking about what do we mean by trauma informed practice, because it's often a really misunderstood term. And what we're really referring to is a relational approach to service delivery that takes into account how common trauma is in the lives of women coming to services, and how those effects can be pretty enduring. And therefore, we need to think about how we can best improve our responses. So it's not about us seeking out trauma and trying to figure out who has trauma and who doesn't, and who has what kind of trauma and who doesn't, etc. But it's really a universal approach to welcome people into services and to ensure that they have an experience of feeling safe, and that their service providers are collaborating with them. So it's not a counseling technique, but instead it's really about how a culture of an organization works in order to support good practice with the program participants and clients who come there. Not based on disclosing trauma, but we like to call it a bit more like a universal precaution, because it's helpful to everyone. And, I think what's really important about thinking about it is this idea of multiple levels, and it really being a lot about what we do with clients, how do we support workers and create healthy services, and how we work with other agencies to create a net of support around trauma-informed practice, and how we actually think about how do we help be a part of the society-wide approach to preventing trauma. So throughout these presentations, you're going to see us talking a lot about these service delivery principles, about creating safety, promoting choice, and building skills. And the thing that I think is so interesting about trauma-informed practice is that it draws on the wisdom from many knowledge bases. And I've listed the ones that I think are really key here on this slide. The contributions of many years of work about violence against women and women's health is definitely woven into trauma-informed approaches. The wisdom from Indigenous scholars and community-based knowledge keepers, like Renee Linkletter, whose book is shown here. The research from public health researchers about adverse childhood experiences, and they greatly contributed to this by showing us that later life chronic health conditions are really related to early experiences of trauma and other adverse childhood experiences. And finally, most recently to the table perhaps are the neurobiologists who've really contributed to us understanding what the trauma responses look like on the neurobiological level. So I think that's what's so important about trauma-informed practice, is that it's coming from the wisdom and knowledge in all these locations. And I think that makes it particularly strong. And so, in some ways, I feel like it's kind of become a movement, trauma informed practice, one that's really concerned with changing the way that we provide social and healthcare services at various levels. And we've been involved in TIP leaders and helping create guidance in many, many different settings: schools, correctional settings, substance use, treatment centers, mental health settings, women's services, child welfare practice, etc. And I think it's another important statement of how much trauma-informed practice isn't a flavor of the month when all these systems are seeing it as important and thinking about how collectively we can really change our paradigm. So, one of the things that often happens is that as soon as we say the word trauma, people assume that we want to drive people to trauma therapy and are referring to trauma-specific approaches that are delivered by practitioners who have a lot of training, that focus directly on trauma recovery, explore experiences of trauma, and really are all about, a consented approach to dig deeper. But that actually is not trauma-informed practice. That's trauma-specific work. Whereas trauma-informed practice is really about us thinking about how we're supporting people to connect to the services they really deserve and develop great coping strategies and strengthening their skills and strategies for growing and be healing from trauma experiences without it necessarily being a therapeutic thing, but much more of a welcoming service that really helps with safety and trustworthiness and collaboration as well as skill building. So trauma-informed practice being done by everybody in every type of service without specialized training, and trauma-specific work being done by therapists. And really so important for us to think about the connections between these two types of interventions, and the people doing trauma-informed practice really needing to be aware of what the trauma-specific ones are so they can link those women who want to go the deeper route to those trauma-specific services. So, one of the things we found when we had discussions with people at the YWCA was that there were a lot of misconceptions. And one of them was that, if we know that people have experienced trauma, then we need to get them to treatment. And so the first and most important thing we talked about was really creating the idea that people are very resilient, that they even got to the YWCA shows that they have amazing skills at powering through and finding the services that they need. And that within those services, we need to be able to give them a great experience and the opportunity to say, do they need something more like treatment or not? And not assuming that everyone will go that route. The next thing that people said was, oh, well, that means that if we think everybody's experienced trauma, then we just have to let them do whatever they want because, of course, they've had a bad experience. And one of the things that we're really clear about was that trauma-informed practice means we're compassionate towards people who've experienced trauma and everybody accessing services, and that we also really do create boundaries and the rights and responsibilities that people have already thought about in terms of living in shelters and accessing services still apply. But we do those discussions about rights and responsibilities and engagement in ways that are really creating safety and being trustworthy, being collaborative, supporting connection, etc. So it's not a free for all. It is definitely actually a more structured approach to really understanding how we can be most useful. And the final one, I guess, was that people in the Y felt, well, we've got to address trauma ourselves, even though, we're in the business of housing or child care or camping or whatever other kinds of things. And really, again, we were trying to reinforce that trauma-informed practice is not about directly addressing trauma experiences, but is creating environments where healing and growth are possible. So all the way through the various training sessions you'll see on this site, these 4 principles stand out that we've woven through all of the work. This idea that we as workers really need to be aware of trauma and people's responses to trauma and be ready to respond. We need to be able to create safety and trustworthiness in our interactions. We need to offer choice and control and really foster collaboration in our interactions with the different service users. And most importantly, I think, really, is that we need to be focusing on strengths and resilience. We're not case seeking for trauma. We're actually looking for resilience and supporting women, children, families in really enhancing the coping skills they already have and moving towards wellness and healing. So on this part of the website, you will see a sheet that kind of summarizes some of the basic questions that we started with at the YWCA here in Toronto that may be helpful as other agencies work on these issues, and you can adapt for your own purposes. So that's the intro to trauma-informed practice.